Hi, my name is Megan, and today I will be testing the cranial nerves on my lovely patient, Caitlin here. So, the first cranial nerve is oculomotor, and so that tests the sense of smell. So what I'm going to do is, if I can have you please close your eyes, and then can I have you plug one of your nostrils? So I'm going to bring something up to you, and just let me know if you can smell it and if you can try to identify what it is. Take a big inhale.
Oh, it smells good. It's a candle of some sort, like fruity flavor.
Yeah, plug up the other nose, and we're gonna do the same thing. Inhale.
That smells really good.
Okay, so she passed that test. So the second cranial nerve, is the optic nerve. So that's going to be testing more of like the visual field. So what I'm going to do first is just get her range of what her visual field is. So if I can have you, I'm just going to have you just stare directly at me. I'm going to come around you, and I want you to let me know when you see one of my hand movements, okay? So just stare directly at me. Don't look anywhere else.
No.
Okay?
No.
Okay, so then this would be her visual field. And then we're going to also do it up. So I want you to still look at me. Did you do that?
Mm.
Okay. And just let me know when you see it come into view.
No.
Okay, and then I'm going to come from below. Let me know when you see it come into view.
No.
Okay, and then this is her other view. So then we'll go on to test the quadrants for the optic nerve. So I want you to stare directly at me, and I want you to tell me how many fingers you think that I'm holding up and moving, okay?
Okay.
Stare directly at me. Make sure it's in camera, okay?
2.
Okay. 3. Good. All right. So in that sense, oh, wait. We'll just do that too. Okay, so can I have you now close one of your eyes? Forgot about that part. Sorry. So that was just an in general view. So now we're going to look more directly at her right eye with her quadrants. So same thing again, just look at me and let me know how many fingers you think I'm holding up.
3. 2?
Yeah. Okay, so then in that sense, her right eye and her upper left quadrant and then her lower right quadrant are good. And so next thing we're also going to do, that's kind of going to test both of the optic and the oculomotor, is going to be the pen light test. So what I'll do for this is I'm going to shine the pen light in her right eye, and I will want to watch for it to constrict. And if that right eye constricts, it means her optic is still good and intact. And then I'll also look and do it again at her left eye, and if that one constricts, that means she has a good oculomotor. So I just want you to look at me. All right, that one was good for her right, and so now look at her left eye. And that one both constricted, so she would be good. So then next what I'll do is I'm going to test the eye nerves, so like the oculomotor, the trochlear, and then the abducens. So for that, I'm going to do the H test so I can see her eye movements. So all I'll have you do is just watch my finger, make sure it's in view. And as I do this, I'm just watching to make sure that both of her eyes move. But this one, I'm looking at her left eye in particular to make sure that it's moving with my finger. So I go back to the center. I'm now looking at her right eye and making sure that her right eye is moving and following my finger. And they both did. So next is cranial nerve 5, which is the trigeminal. So this has the 3 sub nerves, the ophthalmic, the maxillary, and the mandibular. So they all kind of do different things. They all do sensation and then of different parts of the face. And then the mandibular does more of your muscles of mastication. So in order to tense the sensory portion, I'm going to use this Q-tip, and I'm going to lightly be touching her face with her eyes closed and to see if she can feel it. So I'm going to have you close your eyes. I'm just going to gently touch your face, and I want you just to let me know where you think you feel it, okay?
My left forehead. My right jaw. My left cheek. My right forehead. My left jaw. My right cheek.
All right. And from that, I would conclude that she at least has all of her senses for those subcranial nerves. And then for the motor part, what I'm going to do is I'm going to examine mostly her jaw. So I'm going to check for a lot of symmetry. So I'm going to have you open your mouth and close it. And then what I'm going to do is is it okay if I touch your face?
Mm-hmm.
So I'm going to touch her face to feel where her temporals are on both sides. And then I'm going to look for about that bridge of that. You know what? That's fine. And so what I'm going to do is then I'm going to have her... Yep, that's fine. I'm blanking on the name, but I know it's the bridge part of the skull. What I'm going to basically have her do is, can I have you relax your jaw? I'm going to have you clench. And I'm looking to feel, to make sure that the temporalis and the masseter muscles kind of like bulge into my hand, and which they did. So I would conclude that at least those muscles relatively are okay. And so another thing that we can do is test the jaw reflex. So I have my little reflex hammer. We're going to try to see if I can make it work. So what I'm going to have you do, Kate, is I'm going to have your mouth just slightly open, and I'm just going to place my thumb here. And I'm going to be looking to see if her jaw, when I hit the hammer lightly, if it moves a little bit. So I'm not going to hurt you. I'm just going to come in. Oh, nope, I did that last time. At an angle, and I'm just going to... Yeah, I could feel her jaw slightly move down. It was kind of hard to see visually, but in that sense, the reflex, I would say, is still good. So then next up is cranial nerve 7, that is the facial nerve. And then for that, what I'm going to do, so I'm going to have her do some facial expressions, and I'm just going to watch for symmetry, to watch for hopefully that there's symmetry and hopefully there's not any kind of asymmetry. So what I'm going to have you do, Kate, is can I have you raise your eyebrows? Yeah, you can lower them. Can I have you smile? Can I have you frown? Can I have you kind of like wrinkle your nose like you're smelling something really stinky? I think that was it. Yes. So for there, as I saw and hopefully you were able to see, it looked like she had symmetry whenever she made those motions of her face. So next up is a vestibular cochlear, which is cranial nerve 8. So that deals a lot with hearing and balance. And so in order to test that, there's kind of two ways that we like to do it. The first one is where I'm going to be moving her head to see if her eyes are still locked on me, to see if she has some good balance. So what I'm going to do, Kate, is I'm just going to have you look at my nose and look directly at me while I move your head. Is that okay?
Mm-hmm.
And just keep your eyes right there. All right, good. And so her eyes were locked on me the whole time as I moved her head, to me saying that she has some kind of good equilibrium. And so the next test to test mostly her hearing for the vestibular cochlear. So I don't really have a tuning fork. So what I'm going to do is I'm just going to like rub my fingers together like that next to her ear with her eyes closed to see if she can hear it. Have you close your eyes? Can I have you tell me which ear you hear a sound from and if you can hear anything at all?
My left. My right.
All right, there we go. And so then that shows me that she at least has some kind of good hearing. So then next would kind of be a combination of the glossopharyngeal and then the vagus nerve. And then for those, it's more of looking at the uvula. So what I'm going to do is I'm going to end up having her open her mouth, and just kind of like how you do at a doctor's office, you go, ah, and then I would look to see if her uvula is going to stay where it is or if it's going to deviate onto one side. All right, so can I have you just open your mouth and go, ah,
Ah.
have you stick out your tongue a little bit?
Ah.
Okay, there we go. Thank you. So her uvula didn't deviate anywhere. It just went straight up like how it should be. To me, saying that she doesn't have any kind of, like, nerve lesions. And so then next, I will test the accessory nerve. So the accessory nerve, you can test it with the upper traps, and you can also test it with the SCM. So for the upper traps, what I'm going to have you do is, can I have you first just raise do a little shoulder rub. Relax. Can I have you do it again? And just hold it, and I'm going to push down, and don't let me push you down, okay? There you go. So for me, her upper traps are good, which means at least some part of her accessory nerve is good. So then for the SCM, what I'm going to have you do is I'm going to have you turn your head this way, and then kind of look down a little bit. And so what I'm looking for here is that for the SCM over here to like kind of pop out a little bit, see if maybe like they could see it, I don't know. And then, so what I'm going to have you do is I'm going to push against you, don't let me push you back, okay? Alright, and as you can see here, her SCM is popping out, and she didn't, I would say that'd be a 5 for like a manual muscle testing standpoint. And last but not least, we have cranial nerve 12, which is the hypoglossal, and so for that, all I'm looking at is for her to stick out her tongue and just to see if her tongue deviates or not. If it deviates, that would mean that she might have some kind of lesion. So, what I just want you to do is just stick out your tongue. Guess I don't really ever look at your tongue. Okay, put it back in and let's do it one more time. It doesn't really look like it's deviating anywhere. So to me, that would state that she doesn't really have any kind of like nerve damage in that sense. So there is all of the cranial nerve testing.